two members, I think it's two members of the Jackson family, Ann Jackson and her daughter Aesha. They're really quite remarkable people. I've had the privilege of talking to all four members of the Jackson family, and we have a conversation about really what it means to sort of find a language for illness, and really how a family that is in many ways so literate deals with the incredible challenges that they face when they're confronting a serious illness. Do we have Ann and Aesha?
Yeah, we're here.
Yay, okay. Hi, how are you? Is it Ann and Aesha? Do you anybody else there? Or is it just the two of you?
Well, hopefully Ashaun will join us in a few minutes, but because he's going to take lunch. But right now you have Aesha and I.
Okay, greetings. It's so nice to see you again.
Yes.
So Ann Jackson they're a Chicago family. And Ann is a physical therapist. She teaches, that must be Ashaun, medical ethics. And she has founded and runs a food cooperative. So in every sense of the word, Ann Jackson, you are a literate person. You know the healthcare system. You interact with it in so many different ways. But tell us a little bit about your family and what kind of challenges the whole question of health literacy brought to you when your family was faced with serious illness.
Okay, so Ashaun joined us.
Hi, sorry, I just got off of work.
No, that's all right. We're happy to have you. So thrilled you could be here.
Yeah. So I would say that, as you mentioned, Chris, we've been a family of caregivers and community stakeholders for a lifetime, and thought we were helping others to navigate spaces and to get the best out of their healthcare experiences. And when we were confronted with our own kind of more directly, then we really saw that we were not armed with the right things. And that just as Dr. Rita said, the relationship was not bidirectional, and we were seekers, and those who had the information were very reluctant to share, are very uncomfortable with what needed to be shared. And so their ability to convey information was somewhat limited, and they made a lot of assumptions about what we knew, what we didn't know. And then when something would happen, then they'd say, oh, well, we put that in your my chart. And you'd say, how was I supposed to even know what that meant in my chart? Because I didn't understand those terms. I didn't understand the context of that. And even with diagnostic numbers, so there's some tests that they'll give you a score for the test, and you don't know if that is a true numeric value and that numeric value stands for something, or it's a part of a range. So we've really had to do a lot of educating of ourselves in lots of different ways. And we entered the space with me having a cancer diagnosis in 2015. And then unfortunately, our lives have kind of stayed on this course with my children subsequently having some significant health issues that now leave us all with quite an extensive medical history.
Thank you. Aesha, you were a young adult. You're an engineer. You're a person very capable of living your life and taking bodies of information, figuring them out, coming up with solutions. How did your diagnosis impact you, and how did that, your background, either help you or not really help you that much under the circumstances?
I believe that my background has helped, not necessarily as far as being an engineer, but being a caregiver for people who have been living beyond cancer diagnoses and other serious health challenges. I've been able to learn how to ask the right questions, but it's been really difficult to do it for myself because when you're in it, you are just focused on, getting better. Sometimes it's just the shock of being sick and not really being able to process all the information all at once. I think those are the biggest ways that I've been able to navigate this space.
But I think as an engine, well, I was just going to add, I think,
Go ahead.
I was just going to say, I think as an engineer, though, she's really come into this with certainly an emotional hat about things, but also there's an analytical piece of it that I think you brought in. And she'll say, okay, tell me the facts. Like, what do you know? What does this mean? And then be able to take that information in as a scientist and as an engineer. So I do think you have brought that background in. Mm-hmm.
But when we talked the last time, you talked about the emotional readiness to receive information, the emotional ability to hear what's being said and understand it. Can you say a little bit about that?
I'm actually really nauseous.
Okay.
Excuse me.
She's going to get up for a second, but I think that Ashaun's hanging in here with us, so he might be able to offer a little bit more. I think that, like, well, she said that she's been really good about being able to think about the information, but sometimes the information has just been overwhelming, and the amount of information and then just her emotional readiness to take it in, because I think that her diagnosis was the most recent, and I think that we're all still probably in some level of shock about it.
Ashaun, you also talked about that, the difference between just understanding facts and also being emotionally ready to process it. Can you talk a little bit about that for us?
Yeah, I mean, at the very least, like when mom got diagnosed and kind of like starting to, I don't want to necessarily say snowball, but I guess that's kind of the best term I can think of. At the very least for me, getting that diagnosis for myself, at some point or another, I kind of started thinking in the sense of, I guess, like water in a jug. If I remember correctly from last time we spoke, that the information about what is going on and the steps to do is the water, and the emotional and mental availability for me to process that is the jug. Sure, like the water can flow and fits inside the jug, but at some point or another, the jug is going to be too small, or the water is going to be too much for the jug to hold. And at the very least for me, for my diagnosis, there were, I could have done a lot more research on things and like how Rose-Idorf works, but even then there wasn't a whole lot of information for that. But at some point or another, I just kind of decided to stop looking up information for that. Not necessarily because I wanted to be just have some sort of ignorance is bliss, so to speak, but more in the fact of I just, at this point of my trauma, was just not mentally, emotionally available to just take the time to process all of this, because I still have to live through it. And at that point, my availability, my pot was very small. Yeah. Now, as I got better, or as the treatments kind of processed along and kind of got used to it, obviously that just kind of started to grow a little bit bigger each time. But even then, it's just at some point or another, you have to do what is going to be best for you, whether that is if you feel as though that you need to have some information on hand just to kind of keep in the back of your head, or more of the not just like, no, I did all the processing of the information that I want to know at this moment. I may or may not pick this back up, but that's kind of okay. And that's just kind of something you have to go through and deal with.
Yeah, and I think it really helped us, Chris, to think about, other people that were on these journeys, and especially who were new to the space, but really saying to them, please take somebody with you when you go. Yeah. Whenever there's a conversation about you, please take a scribe, take another pair of ears, take another listener with you, because to Ashaun's point, Aesha's point, and my point, sometimes it is just too much, and and that is such a foundational practice for health literacy. It's just getting the information, whether it's understandable or not, but just being able to get information.
Right. That whole notion of making yourself making it accessible to you, making it available to you. So tell you a little more, Ashaun, the condition you have is a very rare type of blood disease. I guess it's classified as a cancer. I mean, how was it to suddenly be hearing about a disease that you had never heard of, that nobody had ever heard of? And how does that change? You mentioned that, as you go through it, you change more. How do you get better at it as you move through the process?
I mean, I guess in that sense, it's kind of almost somewhat of a trick question, because even then, like for Rosa Dorfman, of it being an orphan disease, of not only there only being, I think, between 10,000 and 100,000 recorded cases ever for this.
600,000.
600,000 recorded cases ever for this disease, but also in the fact that this shows signs early on in children at the age of 10, and that their lymph nodes in their necks are swollen. So even with all of that stuff, when I got diagnosed, that was still such a surprise to everybody, because that didn't fit any of the bills as how Rosa Dorfman
manifest itself.
Yeah. Mm-hmm. And I guess it's like at some point or another, you just never really get over it. I guess it's like with any sort of trauma that you have or anything, it's less about finally getting over the trauma and more about how can you make it easier for you to live each and every day with it.
Anna is both a person who has been a patient and a caregiver for both of your adult children. What's the difference between being the patient and the caregiver in terms of understanding what's going on?
Yeah, I think I was telling Aesha the other day, I think as the patient, and she said it so well, it's really like an out-of-body experience for those of us who've had these catastrophic illnesses. I think often you just kind of want to, you just want to get through the experience. And so you try and almost take yourself out of your body. And because there is that period of time where you're probably still in shock about it. So I think that's why it's so important to have someone with you. I think as a caregiver, I just said to her earlier this week that I feel like I'm always on. My autonomic nervous system is always working because I feel such a sense of responsibility to get it right. And when Ashaun was sick, the same. And I don't know if it's my mom has both of my parents have been ill, and I've served as caregivers for them, but there's such a difference when it's your children. And I feel like I was at a heightened sense of sensibility with my parents, but I also feel like with my children, it's even a higher sense of sensibility, if I could even imagine that. And so I'm always constantly wondering, did we ask the right questions? Are there new articles out there? Is there anything else we don't know? Did the doctor tell us everything that we needed to hear this last time? What other questions do we have? Did they email us back? So I'm constantly checking and rechecking and thinking. And I feel like in the role of the caregiver, you're never able to turn it off or turn it down because the need to get it right is so critical to moving through the day, or even just believing that your loved one is going to have another tomorrow.
So last time we talked, your husband was with you, Aubrey, and he talked very nicely about how every field has its own language, and people were very comfortable speaking the language within the field. But if you're not in that field, the language, you don't know that language. So what, as a patient and a caregiver, sort of what responsibility does the physician or the healthcare provider have to make that language accessible and intelligible to you? And how do you feel as a patient? What do you have a responsibility to learn that language so you can speak it, so you can be in that country?
Yeah, I think that for, Malcolm Gladwell talks about how, we sum each other up in seconds. And once we sum each other up, then we put you in a box and we kind of know who you are, and we know kind of how you flow contextually in our schema. And I think that what we learned from my diagnosis, Ashaun's diagnosis, was that when you enter into a new relationship, you need to establish some shared language. So when Aesha became ill, and a good word is nauseated, not to be nauseous, because we've all had chemotherapy, but it looks and feels very different for each of us. Each of us had a very different experience with being nauseated. So when we met Aesha's team, we said, tell us what you mean by that. When you say nauseated, what do you mean? And they gave us their example. And then my hope had been they would have said, Aesha, in your past experiences, when you've had nausea, what does that mean to you? But they didn't. And I think so those little things help establish some very fundamental communications, especially for people that are going through things that are going to cause adverse responses in other systems. So I think that's very important. But I don't know that everyone has that ability, and everyone doesn't even understand that those are things they need to ask. And again, I think that the healthcare team, for lots of reasons, will gloss right over a lot of this. And so we don't enter the relationship with a shared lexicon, a shared language.
Well, I mean, but sorry to interrupt,
No.
but I mean, that also kind of makes sense when you think about like for the healthcare field in general, right? Like most people say, oh, like, well, I go to the doctor because they help me feel better. So yeah, that's great. But like, they're trying to see all of the patients that they can. And it's just unfortunate the fact that like they either from them entering into the medical field or like for medical education, that doctors are not taught, or at the very least, it's not super enforced, or rather, I should say, it's not super enforced on the adult side, that you need to talk to people as a way as like talking to a normal person. Now, I know I cannot speak on having care on the adult side, like my mom or my sister have. I have had care because it was a pediatric disease. I had care on the children's side. Mm-hmm. And the thing that I was completely blown away by was that how all of the doctors took the time to communicate that. I mean, obviously there was some of the medical jargon that was still kind of thrown in there, but they took the time to be patient and to actually show compassion and care with with whoever they are. And that makes sense because it's very hard for a 5-year-old to understand, well, why am I going to this weird place? It's cold all the time. I don't like it here. Why do they have to stick a needle in my arm? Why do I feel sick every time I have to go here? And it's just almost in the sense of like, we think that kids just need this, but adults don't. And just thinking of how scary it is, even from like age 5 to age 50, of just going through all of this. And yet it doesn't show anywhere in the framework the compassion travels from the pediatric to the adult side. Now, mind you, it could be because maybe the children's side historically has a little bit more research money thrown into it. And maybe, just again, talking to the fact of like trying to calm down a scared 8-year-old. But I think that also should be in consideration as well. No matter what, if a person is going to you because they are sick or because they're going through treatment, they're going to be scared because nobody knows what's going to happen next. Mm-hmm. And the best thing that you can do as a healthcare provider is to try and reassure them with every step. And that also means trying your absolute best to share some sort of common linguistic traits, I should say.
Mm-hmm. Yeah. So everybody's got a role to play for sure. The physician, and not just the physician, but every member on his team, mm-hmm. because so much of specialty care is a physician leader, but they're supported by a team of other experts within that particular discipline. So whether it's heart disease, oncology, so that this whole team believes themselves to be subject matter experts, and they all have a responsibility to the patient. Ultimately, the physician does, But I think learning needs to be happening. Learning and literacy needs to be happening and being shared all across that continuum.
Mhm.
Yeah.
And it can't be just a one-time thing. It has to be a consistent thing, right? Because like regardless if the doctor or the physician's team sees hundreds of people a day to maybe up to 1 million people a year, that patient only sees one doctor unless they decide to go, somewhere else, but they only have one main caregiver, and that's that. And it should be essentially almost kind of treated as such. Mind you, obviously, like with time constraints and everything like that, but that's another big thing that I think a lot of physicians just either it just gets swept to the side because they have other stuff that they have to do, or they just kind of forget, whether or not that they have to go see a patient, they have to go, perform a surgery and something happens and they have to go into work the next day. I understand that from the mental aspect, but there has to be more compassionate engagement and more willingness to form a mutual relationship of communication.
Aesha, and you're still under active treatment. Have you had an opportunity, or has there been an instance in which a physician said to you, "Do you understand what I'm saying? Do you need more information? Is there anything I can do?" Have you had that kind of an exchange with the doctor, or have you asked for that?
No, I have not had that kind of exchange with the provider. I often ask a question of, is there anything else you need? Is there any other information that I need to know, or any other questions that I need to ask of them when receiving my care? But I typically do not get a follow-up such as that.
Mm-hmm. And I think the other thing is that we find, and Aisha's case has been, I guess, most consistent, that again, because the information is, because often they must run through this information and maybe people don't ask as many questions as we do, they almost seem as though you throw them off script when you ask a question. And so when we are following lab values and if something changes, we are usually the ones to reach out to them to ask about a change before we hear from the team. Or when we see results of something that maybe we didn't even know that this particular test was being done, then we have to do the Google search to figure out what does this test mean? What do these values mean? And then reach out to them to ask questions. And I don't know whether that is just because they have so many other responsibilities, as Ashaun said, or if in the time of COVID, we've all kind of changed our mindset and maybe health literacy is not as important as it was pre-pandemic. But whatever it is, I think that we've seen a lot of gaps and a lot of opportunities where better communication could be developed.
One thing you mentioned in our previous conversation, Anne, was that people have different learning styles. They learn differently. What could you say in terms of the doctors becoming more kind of health literate competent, as Dr. Shimon was talking about, in terms of what they could do to use to address different styles of learning or to use different ways of explaining things?
When we spoke earlier, I mentioned that there are two things in the world that are universal: numbers and pictures. And when you can draw a picture, even if it's a stick figure and it's very rudimentary, then it doesn't matter what language I have, what language I lack, what vocabulary I have, or what vocabulary. But if I can understand a visualization, then that's universal. And I think oftentimes there are these great opportunities to start with the visual story. I know that Dr. Sharon says, the narrative, but I would say at the heart of the narrative often is the visual story, because that is a language that we know. Numbers are a language that we typically share, across the world. And I think that those are, again, missed opportunities when we don't start the conversation there. And as Sean said, often in the pediatric space, they might have great cartoons to talk about a cleft palate and what does that mean and how do we close it, or if a child has spina bifida. But we don't see that a lot in the adult space, but that literacy has to be multidimensional, and it has, like he said, it has to come again, come again, come again. So I constantly have to be given information, because Sean said when we were together last time that sometimes we can only take it in teaspoon by teaspoon. And I think that's what Aesha was also saying. So it's got to keep coming. It's got to keep coming. And I think I hear sometimes as a healthcare provider, people saying, oh my gosh, like I just talked to that family. I talked to them again. Now they're calling me again to ask me the same question. And that is not the right attitude. You know, if we are truly going to be in partnership around healthcare, then we've got to have what Gwen said, that bi-directional communication. We've got to be talking. We've got to create a safe space where I can tell my story. And perhaps you can tell your story too, because I think Ashaun said it so nicely both times, that compassion piece leads to that underlying trust. And if I don't trust you, then you can tell me, you know, the sky is blue, but I may or may not believe that, because we don't have a shared understanding of each other's humanity, or that we just see each other as people.
Sean, you want to add anything to that, or is what one thing would you want the health providers to take away in terms of what they can do to become more health literacy competent on their side?
I mean, I guess besides growing a heart, but I mean, like they're doctors anyway, so
You gotta say a little louder.
I'm making a bad joke.
Okay.
But I mean, I think, like I said, I think the best thing for me, or the best example that I can think of, is, and this is going to kind of sound weird to sort of say it, but treat your adults, or like some of like older patients, as if they were children. Obviously not in the sense of not, I guess, even, how do I put this? Sorry, let me phrase this for a second. But coming into that with that idea of like, this person is scared. This person, like, I may see 100 people in a day, but this person sees me once, and I am their main provider. And I need to be as clear, and I need to find solutions, or find ways that I'd be able to help communicate with them easier, to build that rapport, to build that trust, and to show them that there's really, that I know that you're scared about this, but I'm going to do whatever I can in my power to make sure that I can make it easier for you to receive your care, and to help make it a lot less scary. Because that's the thing, that's the underlying thing, that everybody's just terrified because nobody knows what's going to happen next. And at the very least, as a healthcare providing team, you need to make sure that you take the steps to help ease a lot of those worries. And because if not, then you can keep telling people like, oh, well, do you understand this? Is there anything anything else that I missed? But like, there's still going to be that cognitive dissonance that just is going to happen when you just don't keep consistently trying to put your best foot forward in doing this. So like, for example, like for Mom was saying, if you have a family that is constantly kind of going for updates and trying to figure out stuff, sure, I can understand that might get on your nerves a little bit, but in the same vein, that just shows that they're wanting to be actively participating in what's going on. And that should be something that should be rewarded with this positive engagement, not just with simple annoyance.
Great. Aesha, we were pretty much out of time, but do you want to give us a final word? One thing that you would like to have a health provider take away from understanding what real health literacy is for patients?
I think the biggest thing I can think of is compassion, is just showing your patients compassion, and just help provide compassionate understanding for what they're going through, what information they need, and how to properly give it to them. Because I think because patients are going through a lot, and you are their one, even though you have many.
Mhm.
Thank you. So thank you so much, Jack's family, and Anne and Sean and Aisha and Aubrey too, even though he couldn't make it. We really appreciate your time and your insight and your willingness to share your experiences with us. Now, we don't have a formal break put in. We just wanted everyone to know they can take a break whenever they want. But Gwen Darian is going to come back, and she's going to lead a great panel that's going to kind of pick up some of these themes and talk about them in terms of where we really can go with the next kind of a redefining of what health literacy is.